Thank you very much. For the debate, I recognize a member from Ottawa South.
Thank you very much, Mr. Speaker, and it's a pleasure to rise today. And I want to thank the third party for the Opposition Day motion. I'm really pleased, and as all of us should be, that we're debating this afternoon. And the reason that I'm pleased is we're actually on the same side. Although if you listen to question period and to some of this debate outside, you wouldn't be sure. But I know that we're on the same side. You know, if we go back in a bit of history on this short history on what we're talking about here, the NDP a couple of weeks ago announced a universal pharmacare plan that they came out with a couple of weekends ago, just after Easter. I heard the plan. I thought, good, we're having that conversation. The plan had certain qualities. Flash forward to the budget. We put forward OHIP Plus, Pharmacare for children and youth. So universal pharmacare for children and youth. So if you're 24 or under, as of January 1st, we passed the budget. You go to the pharmacy, you put your OHIP card down with your script, and you leave. No cost, no deductible, no copay. I think that that is an incredible shift, not just in Ontario and for Ontario families, but it is an incredible shift across this country. It's something that I'm exceptionally proud of. I'm really proud of the work that the Minister and the Premier continue to do for national pharmacare. You know, Medicare, Tommy Douglas is the father of Medicare. And Medicare is the thing that we do for each other. And it took a great deal of courage for Tommy Douglas, because if you read and look back at what happened at the time, there were death threats. It took a lot of political courage to do that, a lot of political courage. And he's the greatest Canadian. But you know what? There are a lot of other great Canadians who've moved universal Medicare farther along over the last 60 years. So, and they come from all different parties. I'm not going to go into the litany of what our party's done or what that party's done. We've all done that because we know that that is our responsibility to the people who we represent. Now, coupled with that, all parties have had to make really difficult decisions about what they were going to do going forward, having to choose some things over other things. It's not easy. We all know that. So to pretend that it's easy, and sometimes that happens in here, is really not doing a service to the kind of decisions that we have to make. So I hope that, I believe that this is the beginning of a national push for universal pharmacare. We need the support of the federal government. We need the federal government and all the provinces working with us, as has been said in debate, I think, on all sides here, to ensure that we can deliver an effective program for all Canadians. You know, when Tommy Douglas instituted Medicare, and as things grew over the 60s, and, pharmacy was not a big part. Pharmacy was not a big part of the cure for disease. It was part of it, but not to the extent that it is today. And it allows people not to have to be in hospital. It allows people with chronic diseases to continue to live longer. It's incredible, the growth in pharmacy. So that's the next place that we have to go to ensure, Mr. Speaker, that we have access to universal Medicare. So what I would hope, this plan is going to start, if we pass the budget, on January 1st, 2018. If you're 24 or under, there will be no cost for your prescriptions. 4 million children, access to 4,400 drugs on the formulary. I think it's critical. So what I ask the parties opposite, both parties, is this is a challenge that'll take courage. So what I'm asking you to do is support us. Join us. I'm not sure it's funny, it's serious. Either you want to join us, you want to work with us if you're interested in national universal Medicare, or you can just continue to try to divide and conquer. There's an opportunity in this budget to vote to support universal pharmacare for children and youth. I encourage members on both sides of the House to support that budget. as I will be supporting this motion. Thank you very much, Mr. Speaker.